So the PERSIST-2 trial was a prospective randomized trial comparing pacritinib versus best available therapy in patients who had thrombocytopenia due to their myelofibrosis. Now, if we look at the other kind of key trials done with JAK inhibitors in myelofibrosis, we see the COMFORT studies where patients have a platelet count over 100,000. Fedratinib, the Jakarta trial, similar cutoff for platelet counts. And even Momentum had a cutoff of 25, where most patients actually had a platelet count over 100,000 in that trial. So, pacritinib has really kind of carved out this niche for the severely thrombocytopenic patients. And really, that's where the wealth of the data is. And we're learning over time that pacritinib has additional benefits beyond just shrinking spleens and improving symptoms, primarily through this inhibition of ACVR1. We can see anemia improvement, as well as transfusion independence in these patients who are massively cytopenic. And so more and more has come out about this. There's a seminal paper published by Dr. O in Blood Advances, really kind of getting into this whole ACVR1 story. And so we're continuously looking at this PERSIST-2 database, as well as the PAC203 database, to better understand how well our patients doing. And what we want to do is take this story full circle. So we want to see that the JAK inhibitor in question here, pacritinib, can improve anemia or ameliorate transfusion dependence, because we know transfusion dependence is a adverse prognostic factor. It predicts for worse survival. And by ameliorating that anemia or that transfusion dependency, can we then translate that into better survival? Of course, the most proper way to do this is a prospective randomized trial, but I think that would be something incredibly difficult to do these days. So we're left to kind of do these additional analyses on the existing databases. And that's really what we're trying to show, is that if we can, one, improve anemia in patients who are thrombocytopenic, and then two, does that impact their long-term outcomes? The best we can tell with these databases. And so we're really trying to, again, take that story full circle. And so this is kind of one of the links in that chain to take that full circle, is where we're looking at specifically patients who are thrombocytopenic, and how well can we improve their anemia or their transfusion dependency, and try to get a sense then too if there's any impact on their long-term outcomes.